Good evening, ma.
See, some persons are paying, so maybe we'll start in the next 2 to 3 minutes. Hopefully, pray the network is friendly. All right, so this evening we will be looking at harmful traditional practices. This network will be good. Okay. I'll focus our attention on female genital mutilation and widowhood practices. I'm sure at the end of the lectures, we'll have gone through all these learning objectives. By way of introduction, harmful traditional practices. I'm sure we can list as many as we can remember. They are harmful practices or customs, rituals, or behaviors that are deeply embedded within our cultural fabric. These practices are detrimental to health, and they affect vulnerable individuals, women and girls especially. They occur across different cultures, religions, geographical space. Harmful practices manifest in different forms, such as gender-based violence or other discriminatory rituals against a particular gender. The practice is sustained by social norms, cultural and religious beliefs, patriarchal structure of the country or community where it's practiced, their belief systems, and is perpetrated by the upholding of power dynamics, the power play within community. Those are the factors that perpetrate it. Despite progress that have been made to prescribe those harmful practices, designate them as violation against human rights, these practices have persisted, perpetrating some forms of gender inequality and gender violence. Some of the examples of harmful traditional practices, we can list them in no particular order. Female genital mutilation stands out, so we're going to pay attention to that, as well as widowhood practice in the course of this discussion. Female genital mutilation, now better called female genital cutting, because the term mutilation seems to be stigmatizing, right? So we can see it being referred to in literature these days as female genital cutting. It's a harmful practice that involves the partial or total removal of the female external genitalia or the female genitalia. We'll soon see the various types. Other examples of harmful practices are forced marriages, coercing people go into marriage against their will. It's a form of harmful practice. Should be discouraged as a violation of human rights. Early marriages, marrying gets off at their early age, often before they reach adulthood, should be discouraged as harmful practice. Food taboos, nutritional taboos, imposing restrictive diets, sometimes on pregnant women or menstruating girls based on cultural or religious beliefs. And then you know that those things are nutritious. It will further lead those people you are restricting the diet, the pregnant women, to have malnutrition in pregnancy, anemia in pregnancy, or anemia in young girls. These practices should be discouraged. They prevent women from having optimum nutrition when they need it the most. Some preferences, another harmful practice, favoring male children over female children. So you find out that they'll be practicing female infanticide. So you detect that it's a female and you kill the fetus. You kill the infant even before they are born. So that's a harmful practice. It's a violation of people's rights and it should be discouraged. Also, dowry prices, dowry price. So now, yesterday we were talking about marriage in Nigerian customs and different traditional marriage setting, the Igbo, the Yoruba, the Hausa. And we saw, I think Fatima was the one who described to us the practice in the north and described the dowry price, transfer of wealth from the bride's family to the groom or the groom's family as instance of marriage. So why that is a traditional practice? Dowry price is recognized internationally as a harmful practice. I'll explain better. That's a bit different from, so there's a subtle difference between the bride price and dowry price. Okay. Who wants to try? I don't know how, I know we don't have much time today, so but I would have loved to go around the room. Someone to differentiate that for me. The bride price and the dowry price. They are not exactly the same. They are not exactly the same. They are not exactly the same. The bride price is paid to the bride from the groom to the bride's family. Whereas the dowry price, like Fatima described to us yesterday during the Muslim marriage, is paid from the bride's family to the groom's family. They are all both forms of exchange regarding marriage, So people will say, so what is wrong? Okay. But it becomes a harmful practice. And let me just say that either of them can become harmful, right? Depending on how it is exploited, depending on exploitations that go around with it. So if I may ask anyone to tell me, either way, how can the bride price or the dowry price become a harmful practice? Can somebody just tease that out? Anyone, 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 anyone. Can you people hear me? Or am I speaking to myself?
We are hearing you, ma.
We
Can
can
hear
hear.
you,
Let
ma.
me try.
Okay, so somebody should try.
Dowry price. Oh, I was going to talk about bride price being harmful practice.
Okay, go ahead. Someone else will talk about the dowry being
Okay,
harmful. So I
so
differentiated
I'll
the difference between bride price and dowry price, right?
mm, I'll give an instance.
I hope
If
that
a
is clear.
family
So go
is
ahead, talk about in what stands from
am
harmful.
I being heard?
Yeah.
Okay, so I'll give an instance. A family, say a family giving out a daughter,
You went
say a
off for a
girl.
while. Yeah. Mm.
I said a family giving out a daughter, say a girl child, not an adult girl child, a girl child, for say a piece of land or to pay off debt. I think that's harmful practice. That's for bride price. Was that it? I'm done.
To that before I. Yeah, can someone else add to that? or someone can take the part of the dowry price as a harmful practice. So let me hear your thoughts.
Hello. Good evening.
Yes, go on.
Class.
Good evening.
Good evening, class. Good evening, lecturer. I want to add a harmful bride price practice is if, for instance, a native doctor charges a patient who he is treating or who is given to him to treat a certain illness, for instance, let me use madness or stroke. Then, after treating, the patient's people or family maybe couldn't pay up the price being charged by the native doctor or the traditionalist or traditional medicine man. Because they didn't pay up or they could not pay up, the man, the native doctor or the traditional medicine man will now do it as a trade by barter. Since you people cannot pay me, I will marry this your daughter. Then you people go. Let it just be that the money you should pay me for treating her is be the bride price that I should have paid. You know, this is kind of this is
So
hello?
I get your concept. Pretty deep. Yes, I get your concept. So, but you know, bride price can become harmful even when the
It's breaking. Your voice is breaking.
I'm struggling to
suspect
hear.
it's
I don't know if it is from my end.
bride
No,
price is
her
set
voice is
so
breaking.
high that it turns marriage into a financial transaction. Marriage shouldn't be a financial transaction.
We didn't
By
quite
the time
get
it's
that.
set so high, that is obviously for financial gain. You tell them to bring that becomes a feel that they have bought the woman because of. You didn't quite get that. When
Yes, from the
breaking.
very beginning.
It was breaking, man.
Yes, the voice is breaking, ma'am.
when the
It's
bride
breaking.
price is set so high, it becomes a financial transaction. That is harmful. All right. That's economic violence. You know,
Yes.
it becomes so high. That's action.
Okay. This network cover thing is very.
I want to believe that it's not my network.
We lost her.
She's logged out already. So let's hold on.
We didn't lose her. We lost our connection.
So this network has started acting up again. All right. So sorry for that glitch. If you can hear me, can you hear me?
Yes, ma.
We can hear you
Yes,
now.
ma'am.
Okay,
Can hear you,
so
ma'am.
I can hear you now.
okay, so I was saying that when the bride price is placed so high that it becomes like a financial transaction, turns marriage into a financial transaction, that can be a harmful practice because it becomes some form of economic abuse. All right. Also, when men feel like they have bought, due to the high price they've been given, they have bought the woman. So that leads to control, and then abusive relationship, denying her rights, that kind of setting, it brings also that controlling behavior. You feel you have bought her over, she becomes like a property, because of the high costs in which they have placed in it. That can be some form of harmful practice. Also, when women are forced into marriage just to obtain payment, like he was trying to explain earlier, in case of the traditional person who did something and could not be paid and then he wants to marry. So that becomes a harmful practice. Now, in terms of dowry price, dowry price is accepted worldwide, internationally, as a harmful practice, even though we know that it's cultural. Like we heard Fatima explain to us yesterday, that's how their own price is paid, but it can become, and it's accepted as a harmful traditional practice. In this case, it's the bride family that is bringing property to the groom, all right, as form of, but then making it more of a harmful practice in the sense that when they start demanding very large properties for the bride to get that husband, it becomes harmful. And then the women can be harassed, abused, because they did not bring enough enough dowry. So the man getting married to the bride is expecting the bride's family to show off wealth. If they don't bring enough, the woman can become abused. And she had explained that, those kind of things, you hardly have to go back to your parents' home. And now you get into the home where it's supposed to be the husband's home, and you're being harassed because they perceive that you did not bring enough dowry. So it becomes harmful. And then also when it limits the woman's autonomy, so making marriage more or less transactional, so it's because you did not bring enough money, that's why you cannot get this. So it becomes abusive. So there's been, in some countries, there's a Dowry Prohibition Act prohibiting dowry. You remember all those forms of honor killings and so on and so forth. So we can mention several other harmful practices. I said we'll talk more too on widowhood practices. There are a lot of discriminatory customs and rituals labeled for widows and then perpetrated against them, which are human rights abuses. Okay, they are harmful practices and they are violation of the rights of the person. Isolation, property seizure, force them to get remarried to someone against their wish, cause them to drink corpse water, several other practices that are harmful. Honor killing, I've mentioned that the murder of individuals, especially women, who they are perceived to have been brought to have brought dishonor to their family. So they have to now kill them in such a setting. Child labor is also some harmful practice. Child trafficking, and other forms of unacceptable corporal punishments are also harmful and should be discouraged. So let's pay more attention to female genital mutilation. I said it's now called female genital cutting for trying to be less stigmatizing. It comprises of all procedures that involve partial or total removal of the external female genitalia or other injuries to the female genitalia or female organs for non-medical reasons. You will call it now female genital cutting. So it started long ago, in the era of Herodotus, the Greek historian. So it's been on and on. It has seen many things. There have been many efforts to stop the practice, but it's still being perpetrated. Historically, suggests that relationship started between like slavery and infibulation, infibulating female slaves that had high price because infibulation was thought to be a form of chastity and loyalty to the owner, and then will prevent them from having undesired pregnancies. So historically, it had that root. So it's associated with slavery. That already tells us that it's a bad practice. Okay, well, there are 4 main types, type 1, 2, 3, and 4, but some of the types have A and B. So type 1 is known as clitoridotomy, type 2 is excision, type 3 is the infibulation, which we explained previously, and then type 4 is other harmful procedures to the female genitalia for non-medical reason. Now, looking at the type 1, it has A and B. The A part is the removal of the clitoris hud or the prepuce, the partial or total removal of the clitoridal gland, the external and the visible parts of the clitoris, which is a sensitive part, okay? And the skin that surrounds it, the gland. So the A of it, type 1A, is removing that prepuce, and then the B is the removal of both the clitoris and the prepuce. So this is like the image that shows you where the prepuce is here and the clitoridal gland. So if both of them is taken off, that still constitutes type 1. 1A is the prepuce and clitoridal hood, and the B is both the gland and the prepuce removed. So, type 2, partial or total removal of the clitoral gland and the labia minora, which is the inner fold of the vulva, with or without removal of the majora, the labia majora. So the type 2 also has A and B. Removal of the labia minora only will be type A, 2A, and B will be both the labia minora and partial or total removal of the clitoris. And I C, type 2C is when the majora is involved, labia majora. So both clitoris, labia minora, and labia majora. It's type 2C. So type 2, A, B, or C. A takes just the removal of the minor and partial removal of the clitoris, which is already part of type 1A. And then type 2C is the one that involves the labia majora. Type 3 is the infibulation. In this type 3, it involves the narrowing of the vaginal opening. So, and then once the procedure, so you still have A and B. The A part is done with the removal of the labia minora. While the B part, the procedure is done with only the labia majora. In this infibulation, there is narrowing. So there's narrowing. It's like a sewing removal, and then you join to open a small opening. So it's known as infibulation, the narrowing of the vaginal opening through the creation of a covering seal. The seal is caused cutting and apposing. So you reoppose the labia minora or the labia majora using stitches, with or without the removal of the clitoris. So they leave a small hole for maybe menstruation and so on and so forth. So we'll see an image that shows how it's done. And then the type 4 is just any procedure, whether pricking, piercing, cauterization around the female external genitalia. That's type 4. So the various types, this is infibulation type 3 that involves sewing. So you cut, stitch it together and leave a small opening. That is infibulation. So like we said, this is a harmful practice. It's a traumatic experience. It should be abandoned. But surprisingly, in many communities, it's still very practiced, even in this day. Even as we speak, it's still being practiced. In fact, in some communities, they said if a woman does not go through the process of female genital cutting, she cannot be buried in the community. It's deeply ingrained in the culture, and it cuts across the educated and the non-educated. In fact, it may surprise you to understand that it's even commoner among those with higher wealth index. I did a study using the demographic and health survey data, and then I studied the prevalence of FGM among youth, and youth, 15 to 24 years old, and pulled data from 2008 Nigerian Demographic and Health Survey, 2013, it's every 5 years, and then 2018, and pulled those 3 years together. So a huge sample size, but the NHS is already a large sample size. Then pulling 3 different data sets to analyze. And even though we see that it showed the trend is decreasing, yes, so there was a downward trajectory. But for the factors that were associated, it clearly shows that those in urban, with higher wealth index are still, it's commoner. So you have a higher prevalence among those group of people. So how can we explain that? How can we explain that? You would have thought that it should be commoner in the rural area. So it cuts across race, region, and education. Cuts across is deeply rooted. People don't seem to abandon their culture, even when they are transiting from rural to urban areas, and even when they have become wealthy. So that explains, in a way, medicalization. So in order to give it another name, they try to link it, get people who are in the medical setting to provide the procedure, medicalizing it, but it's still not acceptable. It's still not acceptable. So globally, more than 200 women and girls who are alive have undergone the practice. Even though I said from that study shows that there's a downward trajectory, so our efforts to stop the practice is yielding some benefits. It's yielding some more still needs to be done. So Africa continent is still prevalent, and even across Nigeria, there are disparities between it's commoner in the eastern region. That's what the data shows. And that's what the data shows. I was going to add it to this slide, that study. Well, you can search it online. One of them is published already, one that talks about the laws is published. The other one is accepted. It should soon be out. And you see the pulling of that NDHS survey data. So you can look it up. We have a downward trajectory. That's the good news. But then the factors that are associated with it tells that you still need to develop context-specific interventions. Don't think it's commoner in rural. I know it's not. There are people that are still in urban, wealthy, that are treating it, even as they are aware that it's a violent issue, and it's a harmful practice. It's a violation of people's rights. They are still perpetuating it. So I go on FGM worldwide. We should try and bring that figure down as fast as we can. We say of passage and all that, but we still would say that data shows there's a downward trajectory. So according to UNICEF, female genital mutilation remains widely spread in Nigeria. There's, like I said, from that study, I can see that there's northern and southern differences in the practice. All right. We also see that among young people, among the youth, there's a downward trajectory. Okay. But the disparity is state disparities, ethnic disparities disparities, religious disparities, and all that. They exist, and we should
Doc, sorry,
use
ma.
those
Good evening, ma.
information to provide context
Good evening, ma.
on specific
Hello, ma.
interventions to
Hello, ma.
stop the practice.
Hello, ma.
Hello, hello,
Doc, good.
your voice is breaking now.
Class rep, I think you should call her attention. You can call her on the phone and bring her attention that she's almost talking to herself, please. We can't hear her. Thank you.
Plenty breakage.
Yeah,
Thank
so
you.
let's allow her join again. Calling her now will disrupt her network. So let's just give her some time to join, then we can tell her here.
Okay, but I think, I don't know, maybe you send text message to her so that she will know that she's always cutting off. I don't know how she will get to know about this, you know.
Our
She
network
knows
is
Maybe you
already.
send
She
SMS.
said it that she's struggling with her network.
But she won't know how much we lose out on hearing her. So it's good we state it.
Don't worry, we'll discuss it. Thank you.
Thank you.
Sorry for that. Someone was asking a question. I didn't get your question. Please take that again. Now the network dictionary, then I also needed to check something.
It's not a question. I was trying to call your attention that you are almost talking to yourself because we are missing you at every point. I kindly request maybe you go back a little bit to where you started with female genital cutting. That's where we started, losing you.
Wow. Okay. As far as where we started.
No. You started. No. Okay. No. Come up a little bit. No, don't go back, ma. We got it from here. After the types of
You got the
mutilation.
types?
After,
Okay.
yeah, we got the types. Immediately after the types, we started losing
Okay.
you.
Here. Here,
Yes,
right?
start here, from here, ma. Yes, ma.
Okay. So I was talking about the prevalence study in Nigeria using the NDHS data set of 10 years now. So 2008, 2013, and 2018. I used that and I did a study on FGM. Saw the trends among youths. I know youths are those 15 to 24, right? Just to see it says perpetrated among young people. So I needed to see that demographics, see what's happening around them. What is clear is that it's declining. The practice is declining, but we need to do more. So that's document assets, okay? But globally, 200 million girls undergone FGM across several countries: Africa, East Africa, Asia, and so on and so forth. African continent, the prevalence vary and it range between 2 to 95%. Some places very high. Even in Nigeria, the prevalence is different from the north and from the south. I think I will put the link to that work on this your slide before I share it, so or you can go online and check it. I said that Nigeria accounts for the third highest number of women and girls who have undergone FGM worldwide. But the good news is that the practice is declining. However, we need to do more. We need to do more. To play the fact that the study I did using the DHS data sets of three data sets to check out trends and in the prevalence pattern. Even though it showed that the trend is decreasing, one fascinating thing is that wealth index was associated with the practice. So those with the higher wealth index had more of why? What would explain that? Those in urban, the same thing. So you would have thought that it would be commoner in rural area, but that was not what that data showed. And this is not just any data cooked from anywhere. This is Nigerian demographic and health. And with the large sample size, that's what it showed. So it means that as people, they don't abandon rural practice or traditional practice, they carry it along with them and perpetuate it still. Okay. So, but we should keep advocating and raising awareness, developing context-specific intervention to end the practice, Across Nigeria, disparities exist between states. From the north, I said it's commoner in the east. Yes, so southeast, commonest prevalence, higher in the southeast. That's what I said. Then the southwest compared to the north. And I said several reasons perpetuate it. Top on the list is culture, tradition, and culture. Even when people move from one geographic to it goes with them. So culture is perpetuating it. Then preservation of virginity, some say cleanliness, some say it's a rite of passage to womanhood, femininity, some say it reduces promiscuity, more loyal to their spouse, and so on and so forth. Some say it's a family honor, some religious requirements, and so on and so forth. And I said it was higher in those with higher wealth index. So that buttresses medicalization. These days being medicalized, trying to give it a medical connotation so that it can be practiced. It's a harmful practice. It is not of any health benefit. Unlike male circumcision, where we know that removal of the prepuce of the phallus, it's helps to prevent cancer.
Please, Ma, we can't hear you.
She's out of the meeting. The network has knocked her off again. Maybe I will just discuss with her. Maybe if she needs to try a different network. I think this particular one is not working at all. Let me leave her a message.
Or better still, let her record this lecture and send to us if she's having poor network.
I think I've suggested it for someone before, for one of the
Yes.
lecturers, but they
I
want
saw.
to, they don't like it, except if they do the version of Professor
Please don't
Madoka.
start that one of recording lecture and sending to us, so please, so that we'll know our direction.
It's not what they want. But the Professor Madoka's model can work, where she plays and talks as well, But let's just flow with what they have. But we need to have a better, at least a better network for us to have a good class here.
Madoka's own is different. Her own is usually lecture sheet, her previous lectures. That's what she replays. It's not as if she records herself and sends to us.
We know, but it's a recorded lecture anyway.
Another thing you consider is her timing, because she said she normally have good network from 4 p.m. Maybe she normally stays somewhere. So if we may also adjust closer to 5 p.m. so that we can do the lecture and go off.
I think that's a good suggestion. Because this night
From the
discussion
schedule,
is always...
she's almost
Yeah.
done.
So,
She's almost done with her schedule, but 4 o'clock might not work for everyone too. So it's
Please,
just
so please, 4 and 5 will not work for everybody.
It's not gotten anything. Yesterday and today, we've not gotten.
it's okay.
I think
We'll just manage. I think
if the network is good at that time, they can send us the pre-recorded, the recorded one. At least it's going to be clear.
Yes, at least the class will not be broken like the way it's breaking now.
So what if we want to ask question?
Is it not the same thing? If she has a recorded lecture and sent to us, we can ask question the next time we meet. It's still the same.
Please,
She's moving off her
please,
page,
we
her
should
track
like
today. So
we
let's
should
not
not
bother.
accept this recording of lectures, because we will need to ask questions and there will be clarification. Instead, we should please tell her to change her network provider. If she's using Glo, to change to MTN or something.
that's a better option. Yeah.
It's a better option. We should not suggest this recorded lecture. It doesn't help, please.
It's okay. It's okay. Please, let's not argue. We are not even debating it here. Let's just flow with what the school wants. But we'll request for maybe how to check our network.
The energy she's using to say the thing.
Really, she said yesterday that she normally has a good network for maybe based on location. Why not adjust at least for this?
but at that time, some of us will be at work now. By 4, we'll still be at work or trying to leave.
Oh, it's too early, please.
So what we are looking for is what works for everyone. If we can have 100 people in the call by 4, if they would even agree, is even better than not having the class at all due to bad network. But we are not debating it, like I said. Let's just see if our network will improve going forward. And the other lecturers coming.
I don't answer the question.
It's also
Okay, I
help
was
that
saying
we
this. I
can
didn't
hear
answer
is
the
our
question.
network.
I didn't answer
So
the
let
question.
her work on our network.
Yeah,
If we can hear ourselves
because
this
I
way,
see like so many
it's
of
our
them.
network.
No, this essay one will just be looking
Let's
at
just hold on. We are still in class. I hope she will join soon. Let's just hold on. Everybody should just exercise patience, please.
Okay, so
We
was it
should.
on VA? I don't want to call your name. Yeah.
I can only imagine how this lecture will be sounding when being listened to. I beg admin, don't send this thing. It will be traumatizing. As far as we know, this lecture is not recorded.
Beg you, try and rest.
Like,
They can stop the recording. Then when she starts, they start the recording again.
I think if we stop it, I don't know if I stop it, I am afraid that it might not sync when we want to get the recording. So that's why I'm very careful to pause the recording. Except if you guys give me a go ahead to try, we can do it.
Please, that would be better because listening to this recorded lecture with all these plenty talk and suggestions.
So sorry, it's network. I really don't know what else to do. My router is on, my hotspot is on. Nigeria is the country where you pay for services and you don't get the value for it.
Hello, ma.
Yes, please.
I want to suggest, sorry for the inconveniences. I want to suggest for something. What network do you use?
I have an MTN router, and then I'm using even though I'm using my phone hotspot Airtel.
Okay.
Because the Airtel router is not responding, but the MTN router is here and it's loaded, and then the phone is hotspotting, and yet the network is not.
Okay.
Although it's 4G,
The
but the router.
MTN is better.
Is this
Okay. The
better?
MTN is better. MTN is better. I thought you are using this, what is it called? That what's it? Is it Econet or what? I don't know this old
Oh no,
something.
I don't have any of that. I don't. No. Please, if you can hear me better, let's find a way to wrap this up. I know you have another class shortly. Just this
It's better
network
now.
making it last longer than it should. Okay, so we're talking about medicalization. Sorry about the glitch. I don't know what else to do about them. Medicalization. So this is a practice where health professionals tend to perform re-infibulation on the female external genitalia. It's also not accepted in whatever form or disguise is done. It's carried out in the health facility. That doesn't make it right. And it's still practiced in most African countries. So it's also harmful and should be discouraged. It should be discouraged. All right. So what are the consequences of female genital mutilation? It can be long-term or short-term consequences. It can be immediate or late consequences. And you can group them using short-term infection, wounds, bleeding, hemorrhage, shock. But you can group them at the way we use health. That's what I usually would tell my students. Remember the health consequences and know that health is in 3 facets: physical, mental, and social. All right. So you can go through physical health consequences, and then group the physical into short-term and long-term. Then you can go into mental and then social health consequences. That way you have enough to mention and discuss. In the event, you have to discuss the consequences. So once you hear health consequences, don't forget physical, mental, and social. That's the definition of health, and it holds true anywhere in the world. Okay. So if we'll use that, we'll be able to mention and discuss as many as possible. Death is also a consequence. The recorded issues of death from shock, from hemorrhage. Some people have died from the practice. All right. So long-term consequences in treat. Some people never recover from the scars using physical consequences. They never recover from the scars. They end up having pains, painful urination, fistula, the common vaginal fistula. Yes. Chronic vaginal infections, infertility, and so on and so forth. Then you look at the mental health consequences, trauma, post-traumatic stress. They never get to even heal from it. If you look at obstetric consequences, you know how it will affect delivery, especially those that have undergone the type 3, how it can affect delivery. Mentioned then psychological consequences. I've mentioned this anxiety, depression, and so on and so forth. So let's quickly look at widowhood practices. Widowhood practices, they are customs or rituals that are imposed on widows following the death of their husbands, which may include some harmful practices like right deprivation, economic deprivation, isolation, so on and so forth. Forced remarriage. In some cultures, widows are forced to remarry either the brother of the husband that died or someone else, and against their wish. Some of them have not even finished mourning their husband and they are forced to do that. This is against their wish. That's a harmful practice, harmful widowhood practice. And inheritance deprivation. Some widows may face discrimination, inheritance rights are denied them access to landed properties and so on and so forth, which should rightfully belong to them and their children. Others face social isolation and stigmatization. They are subjected to some form of social ostracism, isolated from people for years and all that. They go into loneliness, depression, and abandonment. Economic exploitation is there too. So if you have a widow whose husband was the sole breadwinner of the family, and those things are taken away from her, even whatever must have been left for her, taken away. She may not have the economic power to keep up with her own life and those of her children. So she may also lose their source of income and livelihood. Maybe if it's a joint business, it may also be lost in the process. Then some form of harmful ritual practices, subjecting widows to drink cough water and so on, where money attire for an overly extended period of time and all that. I see this may also have consequences. You can look at the consequences in terms of physical, mental, and social, extend it to economic consequences, and so on and so forth. Now, there are some legal framework that helps us to combat these harmful practices. We said that it's a rights issue, human rights violation issue. So the international human rights law and like FGM are there to back this up. There are other conventions that have the Convention Against Torture and Other Cruelty also puts its weight on it. The Convention on the Elimination of All Forms of Discrimination Against Women, that's had also been there. Convention on the Right of a Child, I told you guys to look at the 4 rights yesterday. The right of the child, the fundamental human rights, reproductive health rights, and the sexual rights. All those rights are instruments and frameworks to combat any form of violence, including widowhood practices and female genital mutilation, or other forms of violence against persons. The WHO in 1997 also issued a joint statement against the practice of female genital mutilation, together with the United Nations Children's Fund. So there have been several alliances and conferences to emphasize that this is a harmful practice and it should be abandoned both globally in Africa and in Nigeria. Africa Charter on Humans and People's Rights and the Rights of Women in Africa, 1986, so spells that out. Okay, in Africa and in Nigeria. All these are efforts that have been put in place, not just as policy statements or law. Some have been implemented in some region. Recently, for us in Nigeria, apart from Nigeria being a joint member of that assembly that's resolved to eliminate female genital mutilation, the 1999 Constitution of the Federal Republic of Nigeria is also an instrument in support of the ending of every form of violence against women and female genital mutilation. The Child Rights Act of 2003 is also an instrument for us in Nigeria. 23 states and the Federal Capital Territory has adopted that. We also have the Violence Against Person Prohibition Law 2015. This VAP law was the first federal law attempting to prohibit it across Nigeria. The VAP law has been domesticated in many states in Nigeria, okay, including our own river states. It's been domesticated. Recently also, in this last edition of the Nigerian Health Journal published an article on the awareness of the VAP law and the prevalence and how it's associated with the prevalence of FGM. So we find that very few persons are aware of the law. Very few, 17% of. Anyway, the study was among young people too, youths precisely. They were the ones we studied. Among those people who we think should be educated, right? We find out that the awareness of the law is low. And then those who think the law is even effective and their understanding of the law is even lower. Okay, so those kind of things, you see that these laws may be available, but how many people really know about it? So we need to drive context-specific interventions that would make people know about that the law exists and they can use it as instrument to stop those harmful practices, even in their community. Mentioned the Child Rights Act and several other rights. So yes, Rivers State, the VAP law is domesticated here, but we need to drive awareness. People need to be aware. They need to be aware that that law exists and is an instrument that can be implemented for the benefit of the people to abandon that practice. Every 6th of February is the International Day for Zero Tolerance of Female Genital Mutilation. So strategies to curb harmful practices. What can we do? We have the laws. From what we have read out from globally, Africa, Nigeria, and river states, you see that the laws are there. So what's the problem? How do we implement and enforce this law? That should be our context-specific efforts. Drive efforts to implement these laws. Let people know that these laws are there. And these laws are meant to protect their rights, protect the rights of widows, prohibit all forms of discriminatory practices against people. Okay. Let's conduct awareness campaign to raise global awareness, strategically raise awareness. People who need to know should know that this law exists and they can use it. Train people and build their capacity to be able to enforce the law. So the law enforcement agency build their capacity to enforce the law. Ensure that widows have access to justice. This country, access to justice is becoming something else, but let's begin to channel effort to ensure that people have justice. Because if they are sure that they will get justice, then they may want to take it up in the law court. But if they know that they'll spend the money and not get justice, so it might be needless to go. It might be needless for them to go. Other intervention, promote economic empowerment initiatives for widows that can help elevate poverty and empower them and reduce their vulnerability. And create social support networks, community-based initiative for widows that can provide a sense of belonging and solidarity for them. Also ensure that they have comprehensive access to healthcare services, including reproductive health services, mental and social support services. This will be essential to improving their health outcomes. So in conclusion, Female genital mutilation has been recognized internationally as a violation of the rights of women and girls. It's deeply rooted in culture and perpetuates inequality between the sex, and it's an extreme form of discrimination against women and girls. So even though we know now that the prevalence is declining, and then there needs to be better knowledge and understanding of those traditional beliefs so that we can raise context-specific interventions that will cause people to abandon those practices. By addressing harmful widow practices, it requires everyone's effort. So let every hand be on deck, and I'm sure that we can combat it to zero level. Thank you. I'll be open to take your questions.
Hello, good evening, Matt. Thank you for the lecture. Can you hear me?
No, I didn't get you. You said what?
Good evening, Ma. My name is Richard.
Good evening. Okay,
yeah, thank you for the
Richard.
lecture. Thank you for the lecture, and sorry for the glitch.
All right, I see some
network.
hands up.
Can I continue?
Is it my network? You're also breaking up. Is it me?
Okay. Thank you, Ma, for the lecture too. My question is, I came in a bit late, so I didn't get the differentiation between dowry and bride price. I don't know if you can just reiterate for just a minute. Thank you.
Okay. So I said the bride price is paid from the groom's family to the bride's family.
Okay.
From the groom's family to the bride. So it's different in terms of the direction, purpose, It's paid from the groom's family to what? The bride's family. That's the bride price. Is that clear now?
Yes.
Is that clear? Why the dowry price? The other way. The dowry price is transfer of wealth or property from the bride's family to the groom's family. But the similarity is that they are both forms of exchange in relation to marriage, And I said that dowry price is internationally recognized as a harmful practice. But I said also that both of them can become harmful practice depending on how it is used. You got that bit, right?
Yes.
Okay. So have I answered your question?
Yes, you have. Thank you. So, but in Nigeria, except in the north, when the other lady talked about that explanation yesterday, I think this side of our south, east, southwest,
Yes.
we practice more of the bride price, right?
Where the practice in the north is mostly dowry price, It's a traditional practice in marriage, which should be a form of exchange. But you have seen we've talked about all the reasons why it can be harmful, especially for dowry price. The bride price can also become harmful practice if you use it for exploitation. The dowry price has been recognized as harmful practice.
Thank you. Thank you.
Ma, please.
That's okay. Any other question? I see other hands up.
Yes. Good evening, ma. Please, ma, can you hear me?
Okay, Samson, go on.
All right, thank you very much, ma. Please, ma.
I can hear you, but please speak up.
There are some culture that a man will not pay money. When he want to go and marry, he will not pay money. They will flog him. They will now use cane to flog him, either a particular number of stroke of cane. Can that also be considered as harmful traditional practice?
Okay. So the culture says that he doesn't need to pay any dowry price, any bride price, but he needs
Yes,
to take so
some stroke
that's
of
a
pain.
physical you know, well, I call it abuse. It's if depends on how the strokes of cane amount to. It's just like using physical force on a child. This one may be an adult marriageable age, but if that becomes brutal, that becomes a physical abuse actually. It becomes some form of harmful practice because it's physical abuse. Have I answered your question?
Yes, ma. Thank you.
Okay. One more hand is up. Nnamdi Ugochukwu. Is that Ugochukwu? Ugochukwu Tuberem. Yeah.
Yeah. My question is, I'm looking at the medicalization of female genital and cutting,
Please speak up.
where, okay,
I'm not sure I can hear you.
My question is on the 13% of Nigerian being part of the medicalization of female genital cutting. I'm wondering if we can have any bad thing that Nigeria will not be represented. And this medicalization that Nigeria is 13%, I am assuming, correct me if I'm wrong, ma, that it is not being done in maybe in a secondary or tertiary health institution, or maybe it's done at the peripheral clinics. Is that correct, ma? And again, I believe that Nigeria is signatory to these international laws. In fact, we domesticated most of them, if not all of them. But yet, we are still violating and doing this harm against the female gender, because these two harmful practices, the female genital mutilation, the widowhood practices, it's just against one gender. I'm not seeing anything against the male gender. So, the first question is this done in a clinic or in a peripheral clinic? This medicalization of female genital mutilation. And again, if Nigeria is signatory to these laws and acts, and even we domesticated them in our country, why are we still having this prevalence that we are having 13% or whatever? Thank you, ma.
Unfortunately, the network is down for Paul. Doctor again. Sorry.
Hi, good evening, everyone. So I just spoke with her now. She's trying to join again, even though she's done with her lectures, but she's trying to attend to the questions. So just stay on the line and hold on for her.
All right, somehow we are done. I was just taking questions, so this network is acting up. So it was the last person's question I didn't quite answer. That should be Zichuku. What was that his name? I didn't get his question and didn't answer that. But we were done. Coach rep, both Basi and okay, I see two hands still up. We'll take your question, don't worry. The coach rep, you reach out to me. I'll send you guys the slides for yesterday and today. Okay. So let's take the remaining two people. I see their hands up and we can wrap it, call it a wrap. Emeka, Amuta, and Metu.
Hello.
Chuku.
Good evening, Prof.
Your question.
Good evening, Prof. Can you hear me?
Good evening. I'm not yet a prof.
Okay. Claim it. So,
My name is Dr.
recently,
Ogbonna. I'm sure you saw it on the slide. I didn't introduce myself. I've met some of you previously. Yes, but
okay.
I'm Dr. Ogbonna. Go on.
Okay, so recently, the Honorable Minister for Women Affairs, Haja Suleiman Ibrahim, she announced that that the ministry will be looking for or has made a budget for $1.2 billion to achieve gender equality. Now, this plan is over the next 5 years, and $1.2 billion is actually about, I think, 1.7 trillion, and that comes to about 250 billion every year if they are successful. But I think it's quite an outlandish vision, and I think it's one of those policy errors where people just think that if they throw money at problems, they disappear. I don't know if you are aware of this and maybe have something to say, such that in case we find ourselves in a space where we can comment and recommend, we can respond appropriately. Thank you.
So that's why that's why you're doing this program. Some of this 2 days slide. Okay, yesterday I had a question on the slide. I usually, as a practice, put a poster. What would MSc students do, to control or stop the harmful traditional practices such as FGM and widowhood practice? I usually leave it as a question on my slide. I still have to bring it back here for what just said. Now, having such a vision, we don't know whether it was guided by it. They have seen yes as like, is it with the want with integrity of that statement being made? Yes, but it's like a roadmap to, put the implementation plan on grant. How is this going to be implemented? You want people to write up grant of what they will do. Are there people that are going to coordinate that to ensure that what that money is marked for, it's actually judiciously used to achieve it? So where are we now? Where do we want to be? Zero or what? And so and so timeline. Yes, what will be the steps? What are the activities that would put in place? What we will measure to show that we achieved it? All those need to be fashioned out. And, data-driven, data-guided implementation is way to go. So yes, you can put up a position paper or a grant proposal application. And for those of you that may be in places of high where the policy on the table, where the policy is made, you begin to use your knowledge of public health, reproductive health, and all that research process, data and evidence-based information to inform those policy directions so that it can actually translate into the change we want to see. So yes, if you are in that space, write up a grant and that what you want to do, be able to marshal your plan and implementation strategies and how it can be evaluated. Problem with our money plan is that we don't want to be held accountable. If tomorrow people say, yes, you release this money, tell us how you use it, becomes an offense. Why should you ask? Why are you to ask? And things like that. But yes, a good one. Okay, it's a good one. And if you are in that space, you can write up for it because there are several money lines in the banks of people that have not been used for what they earmarked it for. All right. I hope I provided some insight to your question.
Yes,
Next
ma'am. Thank
person is Metu.
Okay,
Your
good
other
evening, ma.
lecturer should be around, so don't take her time or his time. Yes, go on.
Okay, good evening, ma, and thank you for the lecture. So I just wanted a little clarification about this medicalization of FGC. Now, I know that in some countries and even in some, I think in some, well, I don't know if Nigeria does it, but I know some women, maybe after they've given birth, say 2, 3, 4 times, some of them go through some sort of, like call it reconstructive surgery, maybe to close up a bit of the vaginal canal, like something like maybe to restore it to almost as in to be almost as good as factory reset. So I'm just
nothing like that.
Is this
There's nothing like that. That's the
medicalization?
imagination of those people who thought it out. Nothing like that. How are you going to restore that to factory setting? No.
Well,
If you have a
maybe
tear,
not to
that's different
factory
from if
setting
you have a
exactly,
tear
but
during
as
delivery
good
and
as
it's featured.
yes. But I know that in
Mhm.
some countries like maybe Dubai, Doha, women that have given birth, maybe because of the tears that must have happened down there, maybe they can request and maybe make extra payment for it. I think they call it vaginoplasty or something, some sort of reconstructive surgery. So I'm just trying to understand if it is the same as this medicalization or it's just something different
It
completely.
isn't the same, but then it's the time they will give to it to justify it. You bring it in a setting where it's a health facility, and at the end of the day, it's underpinned by that same cultural inclination, and that is practiced. You and I would know that if a woman during childbirth has a tear, she'll be sutured immediately. Or even if she's giving an episiotomy, for those of you in obstetric and gynae, to help facilitate vaginal delivery, right? It will be sutured immediately. So that's
Yes.
completely different. So we can give it the name that will make us take away the fact that this is what it is. No. Although there are some plastic surgery events of different scales happening, and so they may want to fit it into that and let it fly. Okay.
Okay, thank you.
All right.
Hello, ma. Can you hear me?
Yes, the last person. Right. Yes, go on, Vincent.
Okay, my
Go ahead.
concern is the type 4, female genital cutting and the now fashionable body piercing that is happening. In the Western world, it is becoming very common, and as we know, what happens in the Western world soon trickles down to our clients. So what's because when we talk about female genital mutilation, it's something that somebody does to the female reproductive organ. But when women themselves present themselves for piercing, would we still call that female genital mutilation with the now fashionable body piercing?
Yes, if it happens at the external genitalia, it will still be classified as type 4 FGM. All right. If you pierce any other place, fine and good. Piercing for whatever reason, they're all harmful. They all have their pros and cons. Those who want it for whatever aesthetics, but infection and the rest of them. But if it's done around the female external genitalia, then it falls under type 4. All right. It will be rightly classified as such. Okay. So hope that answers you. If they do all the piercing anywhere else, fine, it will classify as piercing. But if it's happening at the external genitalia, it will be rightly classified as type 4 FGM. So because you saw the definition of type 4, any other form of piercing, pricking that occurs around the female external genitalia is type 4. They know that exists, and that's why it's within that class. Okay.
I am just worried that females now, we are trying to eradicate it, and females themselves are presenting themselves for such things.
They present the external genitalia for that piercing. I doubt that that's what they do.
They do. If you check, if you just a cursory look at on Google and just say female piercing, you'll see pictures of female genital
piercing external genitalia. So that's taking another trend now. And that means we need to channel our efforts.
I think that the data that you presented may, if we do a recent research.
Yeah, so yes, that study showed that the commonest part is cutting of the clitoris. That's the commonest that was shown. It's not the piercing. It's not the piercing. Yes, so that it looked at the pattern. Well, I would share. It's the gallery proof I have now. So soon be published. I have the gallery proof sent to me by the journal. It will soon be published. But the one on awareness of VAP law is already out with the Nigerian Health Journal. If you search Vivian Ogbonna, Ifeoma Ogbonna, you should see that publication and look at it. But this other one will soon be out. The pattern didn't show that it's the piercing that is the commonest. No, it's still the type 1 cutting of the clitoris that is commoner. But the thing with secondary data is that as much as you would want to explore, you may not find it because it's data that was collected by someone else. I said it's NDHS data. Maybe if it was a primary survey that looked at the type, it could have explored very well or do a qualitative backing to now know this dimension you're calling, what's it about, what's the trend looking like there. But from the data available for those years, it didn't show that the piercing was type 4 was not the commonest. All right. Okay. So that said, I'm sure to some extent I've answered your question. If there are no other questions, I would like to call it a day or a night. I like to call it a wrap and a night.
Okay.
Thank you, ma'am.
All right. Good night, everyone. Bye.
Thank you, ma. Good night.
Thank you.
Good night, man. Thank you. Thank you, doctor. Good night.
Thank you, ma'am. Thank you. Thank you. I feel like now.